Hello, it's David here from Happy Healthy Bodies, and in this video we're going to be talking about knee pain, one of the most common causes of knee pain and what you can do to prevent it. So let's dive in here with pelvis Presley. So this is pelvis Presley, and what I want to talk about here is what's called patella femoral pain syndrome. It's one of the most common causes of knee pain, and typically presents with pain walking downhill, downstairs. It can also present with pain walking upstairs. It's also commonly called runner's knee. So let's talk about what it is here and how you'll notice it. So the first thing I want to draw your attention to is the knee region here on pelvis Presley. So what you'll see is there's three bones. You've got your femur here, you've got your kneecap, and then you've got underneath your tibia right there. So let me just move this up a bit. Your tibia right here. And that kind of forms the knee region. So if we look at the femur here, I'm going to isolate that for you. This is the big leg bone. You'll see that down here, it's got a groove in the bottom of the femur, okay? And the kneecap actually moves up and down in that groove. So when you straighten your leg, the kneecap will move upwards, and when you bend your leg, the kneecap moves downwards. And what can commonly happen is if we get different tension lines running down the knee, particularly down the outside of the leg, the kneecap can shift a little bit in that groove and you can get some rubbing. So the kneecap typically shifts outwards and you get rubbing in the kneecap, and it presents with pain around the front of the knee, right around the top of the kneecap, or around the side a little bit. And again, like I said, pain walking downstairs is very common. So that's called patellofemoral pain syndrome. And now let's talk about what you can do about it. So what you need to know before addressing the specific exercises are what muscles or tissues will get tight and shift the kneecap outwards. Well, if we look here, one of the most common culprits is a band of tissue called the IT band, which runs right down the side of the leg. You can see that right there. That's the IT band. Now, the IT band itself isn't muscle tissue, it's connective tissue, so it doesn't contract the same way a muscle will. However, we can look at what muscles attach into it, and if those get tight, guess what? They're going to pull on the IT band. So a couple muscles attach into it. There's two. There's one called the tensor fascia lata. It sounds like a Starbucks drink. And one called the gluteus maximus. That's the big butt muscle. And they both attach into the IT band. The common culprit is the tensor fascia lata and the outside of the quadricep, which runs right underneath that. When those ones get tight, they pull on the IT band, which can cause tension down the outside of the leg, shift the kneecap over, and you get pain, patellofemoral pain syndrome. So what do we do about it? Before moving on to the exercises, if you like the content in this video, if you like pelvis Presley and want to see more, then subscribe to the channel and give the video a thumbs up. It helps the channel get going, and you can learn about how to optimize your body and how to relieve pain. So let's move into what we do about this. So basically, the theory is we want to release the tension lines in and around the leg here, down the side of the leg and also down the front of the leg, down the quadricep, which runs right here. I'll throw the muscles on. There's the quadricep, it runs right here. And if we can release these tension lines, then the kneecap can move in a more free manner and you won't necessarily get that rubbing. So how do we do that? Well, three ways to try here. So the first thing we want to do is we want to foam roll. So if I head over to the exercises, you'll see foam rolling the quad. So you can get on a foam roller, do it on the floor, not a bed, because we don't want to fall off the bed. And obviously, talk to a health professional before beginning any new exercise regimen. That's important. But this is foam rolling the outside of the quad. That'll release the IT band. Use a foam roller that's a medium density, because if it's too hard, it can actually be quite painful. And don't use one with knobbles on it, because that can, again, be quite aggravating. If you only have a foam roller with knobbles, then wrap a towel around it, and that can soften it a little bit. So we want to foam roll the outside of the quad, do it for about like 3 minutes, and then we can move on to the next exercise, which is foam rolling the front of the quad. And that releases the other tension lines down the leg. Okay, so that's the second exercise to do. And the third one is to strengthen a muscle called the gluteus medius, which helps control the knee position. So let me go back a little bit here to pelvis, and I'll show you here. So if we check out the gluteus medius, let's throw that muscle on here. That muscle attaches from the top of the pelvis down to the top of the femur here. And you can see that just where the muscle runs, if this muscle wasn't strong, the kneecap could swing inwards. The knee would swing inwards. And guess what happens? When the knee swings inwards like that, then the kneecap shifts outwards and you get some rubbing. So strengthening this muscle is very important. So let's head back to our exercises and see how we do that. And you can do this with clamshells. Laying on your side, make sure your pelvis is straight up and down so you're not rolling backwards. And lift your leg up in the air like that. I'll play the video again here so you can see. So that's a clamshell. If that's easy for you, then add a hold for 20-30 seconds. And if that's easy, then put a band around your legs and you should start to feel a burn. You want to do about 3 sets of 10. And if you're holding it, hold for about like 10-20 seconds. And that should really strengthen up the gluteus medius. So those are 3 exercises to address one of the most common causes of knee pain, patella femoral pain syndrome. Again, talk to a health professional before beginning them. But if you like the content in this video, then give it a thumbs up, hit the subscribe button, and we'll see you in another video.